Just to be clear, you're saying we've got more dentists than ever before, but less in the NHS. What does that mean for the whole picture of dentistry across the UK then?
You touch on an interesting point. Although we've got the highest number of people on the register, we don't have a lot of detail about whole-time equivalents. So the nature of the profession has changed over the last 25 years. And in terms of whole-time equivalents, we don't have any accurate data. So we haven't really had effective workforce planning. So yes, it's true, more people on the register, declining numbers of dentists within the NHS. But in terms of whole-time equivalents, we just don't know. And I think with that, and we've been asking for this for a long time, and without whole-time equivalent data, it's very difficult to assess what level of service can be provided potentially if you see improvements within an NHS contractual piece, and we need that information. Now,
is it your, if you could talk about, are people then who can't get into an NHS, are they choosing not to go to the dentist, or are they choosing to go private?
So I think there's both going on.
Do you have a feel of which it is more so, or any data to support which way people are choosing?
I think in some areas we have NHS dental, what people are describing as dental deserts. There is no NHS dental provision. So in Portsmouth, for example, they lost a quarter of their dentists within 18 months. And to me, it seems to be a process that seems to be gathering momentum. I mean, we've done some surveys at the BDA, and increasing numbers of dentists are saying, unless there is rapid change by April, they will leave the NHS. And for every dentist that has left the NHS, there are 10 dentists who are reducing their NHS commitment. So I think there are two things going on. There are some patients who are accessing private dental care when they can afford it. There are some patients who are not accessing any care, and we've had increasing stories of DIY dentistry, which is completely inappropriate, and it's something out of Victoriana, frankly. People extracting their own teeth and filling their own teeth. It's patently not acceptable, not appropriate. But the other story is people having to travel much further in order to access NHS dentistry. And I think that touches on the inequality piece. We can't assume that everybody is able to travel large distances. I come from a rural community. Rural transport links, as we know, are not optimal. I come from not far from your constituency, and people are not able to travel large distances, so all sorts of inequalities.
One final question on this. There is a difference when we bring in doctors from internationally to the process they have to go through to dentists. Should that be brought in parallel? And the likes of, I gather India has an excess of dentists, so there's a question, should we be looking to provide a support or a pathway through to help deal with this? Do you have an opinion on both of those points?
Yeah, so a couple of things. I think the Minister was correct in saying that we have enough dentists, we just don't have enough dentists who want to work in the NHS. So that's the first point. I think we need to have some accurate workforce planning. We then have the overseas examination, which at the moment has I think broadly 2,000 overseas dentists waiting to go through the process. So the process is too long. Some people have actually been time barred. It's taken them so long. So that needs to be looked at. And the process of actually adding overseas graduates to a performer list is taking far too long as well. So there are some quite specific matters of detail that could be ironed out quite quickly, in my view, that would help the situation. We have.
Could you write them to us, because that would be
yeah,
useful
sure.
to have those
yeah.
specifics for our report.
We can do that.
Thank
absolutely.
You.